COVID-19. Much as this virus has not been with us for a long time, we are looking at work of over the last few months, perhaps maybe 6 months, 7 months at the most. But we believe that it is important that whatever experiences we may have acquired so far are able to be shared amongst ourselves. We're also doing this because our own approach as the Department of Science and Innovation and as government is that it is absolutely essential that we mobilize all scientific disciplines that may actually have a contribution to make in fighting COVID-19, that we bring them all together and we create multidisciplinary platforms to be able to tackle COVID-19. So today's conference then will actually be focusing on different parts of these experiences that we have actually gone through in South Africa, but we have also invited international guests who also will be able to share in their respective areas what work has actually been done. So we really appreciate and once more welcome to everybody. And I suppose DG may as well continue to indicate that unfortunately we got a message late last night that due to unavoidable urgent commitments that have arisen, the President is unfortunately not able to join us this morning. He directly spoke to me last night to say that he really apologizes because he was really looking forward to participating at this conference. And then without DG taking powers that I do not have, I want to assure yourself and all other distinguished participants that the President did indeed ask me to then read his speech today. So I'm not power grabbing. I've been assigned officially that with your permission, if you then give me that I am able to actually read the President's address, which he felt that it's very important that I read it as he had actually intended to present it here. DG?
Thank you, Minister. I think that would be appropriate that you proceed with the input that the President would have given at this meeting. Thank you very much.
Thank you very much, Director General Dr. Philip Jwaga, who is the DG of our Department of Science and Innovation. Let me also greet, in particular, the Minister of Health, Dr. Zweli Mkhize, as well as other cabinet ministers and deputy ministers present, the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, the African Commissioner for Human Resources, Science and Technology, Professor Sarah Anyang Agbo, distinguished guests and participants, ladies and gentlemen. It is a great honor to address this conference on harnessing science, technology, and innovation to respond to the COVID-19 pandemic. It has just been over 6 months since the first case of coronavirus was reported, and the death toll continues to climb across the world. A number of countries, including South Africa, are experiencing significant surges in infections. At the same time, we have stepped up collaboration and solidarity. In the global race for solutions, we are pushing the frontiers of scientific research and health innovation. This is not limited to product and technology development. It also extends to the development and improvement of policies, systems, services, and delivery methods. I wish to acknowledge and thank the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, for his support and endorsement of this conference. The World Health Organization has a long-standing commitment to pursuing health innovation for the benefit of all. I also wish to thank Commissioner Sarah Anyang Agbo for her leadership. The work of the African Union Commission in response to COVID-19 has been impressive, especially its support for the African Centers for Disease Control and Prevention. South Africa continues to benefit from various international partnerships in the fight against COVID-19, including the BRICS Alliance, the International Center for Genetic Engineering and Biotechnology, and the European and Developing Countries Clinical Trials Partnership. In May this year, South Africa, as chair of the African Union, participated in the EU Commission's Global Coronavirus Pledging event. We made a commitment to co-invest in the development of diagnostics and therapeutics and in the search for a COVID-19 vaccine. We are currently in the process of finalizing a 25 million rands investment to boost Pan-African vaccine manufacturing capabilities through the African Renaissance Fund. This pandemic has put countries to the test and severely challenged the capabilities of our healthcare system. As the international community, we have been unanimous that services, supplies, products, and technologies for prevention, treatment, and care of COVID-19 must be available to all. No country must be left behind. Resource constraints pose a very real barrier to the ability of vulnerable countries to effectively manage the pandemic. And it is here that scientific innovation will play an increasingly prominent role. Science, technology, and innovation has proven to be an important tool for generating valuable insights and for the delivery of effective solutions. A platform such as this one enables scientists, governments, business, and civil society to engage in open discussion, to share experiences and best practice, and to chart the way ahead. We know that every strategy to manage COVID-19 must focus on behavioral change, and that social distancing and proper hygiene are our safest and best bets at this time. By equal measure, we must continue to work tirelessly to develop technological solutions that meet our most pressing challenge, and that is resource scarcity. One looks, for instance, at the advances in ventilator development and production in developing countries. Soon we will witness the very first ventilators produced by the South African National Ventilator Project coming off the assembly line at a factory in Cape Town. These locally produced ventilators will complement existing stock in the public and private health system and those purchased from or donated by other countries. A number of South African innovators have taken up the challenge of addressing the need for COVID-19 solutions, bulk producing hand sanitizers, developing self-screening assessment tools in local languages, and pioneering contact tracing applications. This pandemic must be a clarion call for African nations to invest in what is already a vibrant Pan-African science and innovation ecosystem. Investment in research and innovation has enabled South Africa to respond effectively to the pandemic. We've been able to support the national COVID-19 response in critical areas, including the development and provision of diagnostic tools, ventilators, and personal protective equipment, and in epidemiological modeling and data analytics. Since the outbreak of the pandemic, we've been able to harness innovations like telemedicine to protect patients and healthcare workers from exposure. The introduction of COVID Connect has enabled over 6 million citizens and healthcare workers to access information on the pandemic through mobile messaging platforms. South African researchers are working in collaboration with international vaccine developers around a potential COVID-19 vaccine. The South African Medical Research Council and the Department of Science and Innovation have provided 10 million rands funding for the first South African COVID-19 vaccine trial. Our researchers and scientists have the expertise to develop human vaccines, having been involved in the development of several other vaccines. But it isn't just in the research space that we've demonstrated capability. We also have important laboratory infrastructure. The National Health Laboratory Service has contracted with a number of universities and government-funded platforms to assist with additional capacity to conduct COVID-19 testing. We have also developed a pathway for the potential production of COVID-19 vaccines locally. South Africa is part of a traditional medicine panel set up in partnership with the World Health Organization to assist in developing protocols for various aspects of traditional medicine usage. The Medical Research Council has also brought together a number of government, academic, and industry partners to support the development and local production of diagnostic kits and reagents for COVID-19. Harnessing the potential of science, technology, and innovation for vaccine and other manufacturing is not just about security of supply. It is also about boosting local capabilities, supporting local industries, and creating jobs. Strategic partnerships in science, technology, and innovation will play an important role in our economic recovery. As we strive to rebuild and repurpose our economies, we will need to explore opportunities in sectors such as low carbon energy, the circular and green economies, smart manufacturing, and big data. There is immense potential for kickstarting economic growth in the uptake of innovation and in driving technological solutions for the delivery of services. It is crucial that we maintain the momentum of international cooperation and solidarity to ensure inclusivity, not just in the provision of life-saving therapeutics for COVID-19, but also in sustainable economic recovery. Science, technology, and innovation are key to healthier populations, productivity, and progress. It is of the utmost importance that they remain a public good. As we collectively strive to overcome this pandemic, we must share experience and expertise. We must pool resources through joint investments, data sharing, and reciprocal access to research infrastructure. We must reinforce global solidarity through science diplomacy. This conference provides a valuable platform to advance these efforts and to affirm the absolute necessity of health innovation as a vital resource for the common good. I wish you well with your deliberations. I thank you. DG, that was, and distinguished participants, that was the message from the President of the Republic of South Africa, Mr. Cyril Ramaphosa. And then, with your permission, and hopefully also with the indulgence of the participants, I decided that so that we are not clumsy, I just proceed and make my own input so that I don't have to come back again. A brief input as Minister now of Science and Innovation. So my stint as the President of the Republic of South Africa has expired. Although I wasn't President, actually I was reading his speech. So allow me then, Director General, distinguished guests and participants, to start by saying this conference, as I indicated earlier, we are doing it in partnership with Minister Mkhize and the Department of Health, as well as our other entities that are part of the Department of Science and Innovation, and others that are involved in research, development, and innovation. Allow me to draw this conference directly then to the contribution of the Department of Science and Innovation to the COVID-19 response. As a department, we have been mobilizing across the national system of innovation, especially amongst its entities and the entities of sister departments, specific initiatives that are currently being fast-tracked to support the government's response to the COVID-19 crisis. These initiatives include the following. The first initiative is deploying DSI, that is Department of Science and Innovation, funded infrastructure to expand testing for COVID-19, a matter that the President has already referred to. We funded technology platforms and laboratories that possess capabilities and have conducted the preparatory work necessary to become part of the national testing network. This includes the following. The Center for Proteomic and Genomic Research has validated various testing protocols and undertaken risk assessment according to the World Health Organization guidelines. It will install a laboratory information management system as required by the National Health Laboratory Services. Testing started in April 2020. Also, the KwaZulu-Natal Research Innovation and Sequencing Platform, known as CRISP, in partnership with the Center of AIDS Program for Research in South Africa, CAPRISA, and the Africa Health Research Institute, have validated the quantitative polymerase chain reaction and sequencing protocols from 2 manufacturers for COVID-19 testing. The other initiative in this regard is that our Council for Scientific and Industrial Research, the CSIR, laboratories were repurposed to do testing in support of government's drive for a massive rollout of testing. That was part of the first in a set of initiatives. The second initiative is in biomanufacturing, which involves molecular biology enzymes, reagents, and testing kits. A local supply of reagents and kits for COVID-19 testing are being developed through initiatives and spin-out companies that are funded by our Department of Science and Innovation, Centers of Excellence, and various other programs and initiatives. This is to ensure security of supply, local manufacturing, and the creation and preservation of jobs. South Africa currently imports testing kits, and local manufacturing will also boost supplies for the continent. This work is at the South African Health Products Regulatory Authority accreditation stage, and in some cases, approval has already been granted. Some of the products were ready for use in May 2020, which is something that we are very pleased about. Our third initiative is the development of personal protective equipment, PPEs. The Product Development Technology Station at the Central University of Technology in our country has been developing personal protective equipment, especially an airway protection device for healthcare workers. The technology station has applied for the appropriate registration with the appropriate health authorities to accommodate these new products under its existing certification, supported through the Technology Innovation Agency. And this work will continue post-COVID-19. We also have another innovation hub, ENTSA, at the Nelson Mandela University, which is using 3D printing for face shield frame design and printing modifications to enable clinicians to easily replace standard A4 transparent sheets without the need for holes and adhesives. The designs are now available, we are pleased to say, through open source networks, which also, by the way, is our own modest contribution towards open science, which is even more critical at this point in time, given a pandemic like COVID-19 that we are facing. This entity at Nelson Mandela University also positioned itself to provide engineering support in our Eastern Cape province and around the country during the lockdown, so as to enable critical projects pertaining to maintenance for the power generation industry to continue. The fourth initiative out of the 6, the technology station in chemicals immediately started with the production of the first batch of 5,000 containers of hand sanitizer to be distributed to staff and placed at strategic points on our university and college campuses for students and on-campus communities to stay safe. The production of hand sanitizers will be an ongoing project until the crisis is over, with the technology station also investigating ways to assist vulnerable communities like old age homes. But also, I must add here, Program Director, that the education sector is one of the most complex testing challenges in managing COVID-19. Whether to open or not, and under what circumstances to open, and what kind of preparation is there, the challenges sometimes facing rural schools and institutions with inadequate supply of water and in some instances, inadequate power supply. So we are making our own contribution towards tackling this, because if there is one thing that COVID-19 has done, not only in South Africa, but globally, it has put into sharp relief the nature and extent of inequalities between nations, as well as inequalities within nations. Our fifth initiative is our coordinating efforts for a local COVID-19 vaccine manufacturing plant, a very important initiative. We have put together a COVID-19 vaccine production task team, which includes the Technology Innovation Agency, the Department of Trade, Industry and Competition, the South African Medical Research Council, academia, as well as local vaccine and adjuvant manufacturers, BioVac, which is an entity that is 47.5% government-owned, and Afrigen, which has investment from one of our state-owned entities, the Industrial Development Corporation. The aim is to get South Africa into a state of readiness to manufacture an approved COVID-19 vaccine locally. In anticipation of the huge demand, should a candidate vaccine be identified, manufacturing facilities will need to be established in different regions, and the SADC and the African continent as a whole will have to be ready. Our sixth initiative is technical support for the ventilator project. The National Ventilator Project was conceptualized by the Department of Trade, Industry and Competition in conjunction with the Manufacturing Circle in order to coordinate and secure a supply of locally manufactured ventilators. The systems engineering skills and experience in specifying and acquiring complex systems at the South African Radio Astronomy Observatory, which, by the way, is one of our entities in the Department of Science and Innovation, was critical in ensuring that a national user requirement and technical specification was developed for publication in the request for proposals. This team has received approximately 100 proposals. 4 potential suppliers were selected and production orders were placed with them for an initial batch of 20,000 ventilators. One of the selected suppliers was, of course, the Center for Scientific and Industrial Research, which was contracted to manufacture 2,000 non-invasive ventilators. Before I conclude, let me also add an important matter on what we've been doing on our side. And I'm not mentioning this at the end because it's the least important, but it's also because I want to pay particular emphasis. We have also mobilized as the department and as government under the auspices of the National Coronavirus Command Council that is led by our president. We've mobilized social sciences and humanities as very important components in the fight against COVID-19. Our two main entities in this regard is our Human Sciences Research Council, which is a state entity under my department, as well as the National Institute of Humanities and Social Sciences, another entity also that falls under my ministry. And we have mobilized these entities to help us understand better human and social behavior in relation to COVID-19. Already from the work that we've begun to do, there are very important lessons that we are learning. Some of these lessons, for instance, is that it is important that we pull in humanities and social sciences right from the word go in dealing with any pandemic for that matter. Because pandemics by their nature, they do not, if it's a health pandemic, but by virtue of being a pandemic, then it also becomes a social and even political phenomenon. And also what we are also learning, which in practice, which is important, is the absolute necessity of a multidisciplinary approach, as there is no single scientific discipline that can be able to deal adequately with pandemics, including COVID-19. That is why my department, we are in the process of establishing what we call an observatory, which will be a multidisciplinary team of scientists drawn from different disciplines who will come together and be able to discuss so that we are actually able to advise government better. In conclusion, therefore, I would be glad if deliberations in this conference today could help us to learn lessons on how best to manage the health and social impact of similar pandemics in future and bring science back to the top of agenda to inform policy and decision making. We therefore value value science diplomacy, solidarity, and open science, as these will help us in fighting the war against an unseen enemy. There is a need to keep the momentum, inclusivity, and equity in the application of the science gains to improve lives, systems, and reconstruction of the economy and the related value chains. I am looking forward to be participating in this very important conference. Thank you very much.
Thank you very much, Minister, for both the input as the minister, as well as the input and the speech that the President delivered. I'd like to continue with the acknowledgements. We're joined also by Dr. Shamila Nebodie, the UNESCO Assistant Director General for Natural Sciences. We also will be joined later by Dr. Michael Makanga, Executive Director of the European and Developing Countries Clinical Trials Partnership, EDCTP as it is called. And later we'll be joined by Mr. Murat Sonmez, who is the head of the World Economic Forum Center for the Fourth Industrial Revolution, as well as Ms. Maria Cristina Russo, who is the head of the European Commission's International Cooperation Portfolio for Research and Innovation. We've also been alerted that we're joined by Minister Dlodlo, who is the minister in the cabinet, and Dr. Dlamini Zuma, Minister Gordhan, and DM Joe Pahla. So they are also acknowledged. I do know that Dr. Zweli Mkhize had some challenges, but I believe he's now joined us. So may I then humbly request Minister Dr. Zweli Mkhize to give his remarks.
Thank you very much, Director General Dr. Mjwara. My colleague, the Minister for Higher Education, Science and Innovation, Honorable Nzimande, Cabinet colleagues, ministers and deputy ministers, the Director General for WHO, Dr. Tedros Ghebreyesus, the AU Commissioner for Human Resources, Science and Technology, Professor Sarah Agbo, all distinguished panelists and participants and members of the media, ladies and gentlemen. It is indeed an honor to participate in this exciting initiative, and I'd like to open by extending my heartfelt thanks to the Honorable Nzimande and his department for the work that has been done in the organizing of this conference, which, as he indicated, we're sharing as the two departments. South Africa finds itself in the midst of an unprecedented global crisis, which saw the novel coronavirus mushroom in China and spread ubiquitously across the planet in 7 short months, reaching a total of 17 million cumulative cases and over 675,000 fatalities. Its clinical manifestations have been mind-boggling, affecting pulmonary, cardiovascular, neurological, musculoskeletal, and other systems, thus mimicking different medical conditions, with the resulting mortality being compounded by pre-existing conditions which we call comorbidities. This has meant, therefore, that the best response to deal with this crisis is interdepartmental and multisectoral, which the National Coronavirus Command Council, headed by our president, represents. Where still is its impact on society beyond health, the pandemic has affected social, political, economic, and other aspects of our lives, changing them for good. We identified our first patient on the 5th of March, and from that first case, we are alarmed to witness a doubling time of 2 days, and were compelled to move swiftly and decisively to institute a hard lockdown on the 26th of March. The lockdown was undeniably effective, as we observed an increase in doubling time to 15 days, with demonstrable flattening of the curve. We needed time to prepare our health services to be able to manage the large influx of patients during the inevitable surge. However, after 5 weeks of hard lockdown, hunger, lack of food and income security resulted in social and economic distress, and it became necessary to focus on saving both the lives and the livelihoods. Thus began the differentiated approach of easing restrictions through our alert level systems. We embarked on this reopening of the economy with the full understanding that an increase in the numbers of cases was inevitable. Indeed, we have seen an explosion in the numbers to reach 482,000, with over 400,000 of these cases being registered in the past 2 months. Despite this huge surge that made South Africa rank the 5th highest in positive cases in the world, we have reasons to be hopeful. We have mobilized support from medical experts who advise us on protocols to put in place for containment, to control cluster outbreaks and guide day-to-day management. We have received international support through various advisories and webinars, and particularly the reinforcements by experts from Cuba and the WHO. May I, Program Director, take this opportunity to welcome and pay tribute to the Director General of WHO, as well as the regional director and the local country director for the outstanding support that they've given to the Department of Health and South Africa in general as we battle this very difficult pandemic. But we have reasons to be hopeful, because lessons on case management and discovery of effective medications such as dexamethasone, the early use of oxygen, and other treatment regime has resulted in mortality consistently below 2%. Our current fatalities stand at 7,812. We are determined to save all lives, and one loss is a life too many. We extend our condolences to all South Africans that have lost loved ones due to COVID-19. Secondly, the recovery rate is encouraging. It has increased to 64%, where it was about 47% about 3 weeks ago, indicating that more people have overcome the infection than those who get new infection and test positive. Thirdly, current data shows an encouraging trend. Western Cape has passed the peak and maintained a plateau for the past 2 months, whilst early indications of promising decline are observed in the Eastern Cape and Gauteng. Other provinces, of course, still drive the increasing numbers. For these reasons, we have to intensify the non-pharmaceutical interventions and emphasize behavioral change to force the reduction of new infections in all provinces. As such, we've established a multi-sectoral ministerial advisory committee which focuses on grassroots mobilization for behavioral change. This seeks to forge collaboration with behavioral scientists, civil societies, communities, traditional leaders and healers, religious organizations, labor, and all stakeholders who are able to effect change at local community level. We continue to manage a number of concerns and challenges, like increasing bed capacity to manage the surge is an ongoing battle which we are winning so far. Triaging mechanisms and facilities ensure that we combat nosocomial transmission. Contact tracing for quarantine and isolation remains key to breaking the cycle of community transmission. We have now augmented our track and tracing functions by introducing a digital system called COVID Connect to deliver the test results, and where users can interact with the healthcare system on a digital platform for case identification, tracking and tracing, and referral to quarantine and isolation or hospitalization. Resolving the strain on personal protective equipment availability due to high demand, overutilizations, sometimes poor quality and corruption, price gouging, maldistribution, giving urgent attention to innovative stock surveillance solutions in order to protect our health workers, as they are the backbone of our health services, and also to avert unnecessary labor disputes. We are increasing human resources for health for all categories and expediting the filling of vacancies and recruitment of new staff. Additional ventilators and oxygen supply is pivotal. A national ventilator program is an important development in this regard. A total of 2.9 million tests have been conducted, increasing testing capabilities beyond our community screening program. Allowed us to identify low and high transmission zones. The targeted testing strategy we adopted was necessary to optimize the use of available resources in the midst of a surge. Antibody testing will still be very necessary in assessing community impact. Participating in trials, for example, the Solidarity Trial by WHO for therapeutics and the ChAdOx1 study for the vaccine development is extremely important to position our country favorably for access to these tools. When they become available on market, it is for this reason we're investing a huge amount of resources to safeguard our future. And my colleague, Minister Nzimande, has touched on this particular matter, as well as the President also highlighted the need for equitable access to both vaccine and therapeutic agents. We need to build a strong base for pharmaceutical manufacturing capabilities and new technologies for vaccine production, diagnostic kits, and production of various medical equipment, including ventilators, PPEs, and others, and embracing telemedicine and various new innovations. The South African Health Regulatory Agency or Authority stands ready to fast-track all applications that promote development of local capabilities. This conference is therefore timeless, as it allows us to open up a wide variety of disciplines of scientific research and harness expertise to advance solutions to combat COVID-19 and strengthen health systems and other systems in society. It will be key to take every opportunity to progress towards universal health coverage. At this point, therefore, I'd like to take the opportunity to thank His Excellency President Ramaphosa for his unwavering support and stewardship as we ride through this storm. We commend our President for the outstanding leadership. President Ramaphosa has led from the front, mobilizing all spheres of government and various sectors of society, and galvanizing all our energy, focus, and resources to mount a formidable fight to defeat COVID-19. This has given our people hope and courage and determination to defeat COVID-19. I also therefore want to thank all my colleagues, my cabinet colleagues, and in government, as well as the people of South Africa, for responding so positively to a very difficult campaign for behavioral change in order to defeat COVID-19. I want to endorse this conference, and I really hope that out of this, more innovative ways will be brought about to help us to mount the most effective response and fight to defeat COVID-19. Program Director, at this point, I want to thank you very much, and thank you all for participating in this very historic conference. Thank you.
Thank you very much, Dr. Zweli Mkhize, the Minister of Health. I would humbly then request Minister Ibrahim Patel, who is the Minister of Trade, Industry and Competition, to give his remarks. And I also believe, Minister, you will also be telling us more about the progress that has been made on the national ventilator project that has been talked about by a number of speakers. Over to you, Minister.
Well, thank you, Dr. Mjwara. Ministers Blade Nzimande, our host today and who leads our efforts in innovation. Minister Zweli Mkhize, who leads our national medical efforts, cabinet members who are present, Director General of the WHO, Dr. Tedros Ghebreyesus, African Union Commissioner, Sarah Anyang Agbo, distinguished scientists and participants who have joined us in this webinar, fellow South Africans. Today, there's no doubt about the devastating effect of COVID-19 on human life and on the economy. A globalized, integrated world brings benefits, but also vulnerabilities. Consider just the sheer speed with which the virus has spread and the more than 650,000 lives already lost. Every life lost is a tragedy for the family and the community. Yesterday, the world's largest economy, the United States, reported a 33% fall in economic output. 33%. This is unprecedented. The greatest quarterly decline in US records. The Bank of England has said the UK is likely to have the deepest recession in 300 years. China is expected to have the lowest growth, economic growth, since the death of Mao Zedong. Across the world, the impact of the virus is harsh. South Africa and the African continent is not being spared, with deep impacts on growth, on jobs, on funds for development. But in the challenging moment, what we can draw on to fight this virus is human solidarity and scientific innovation. And so, honored guests and fellow South Africans, I want to report briefly on progress with an initiative that draws on the best of South African solidarity and innovation. One of the most serious effects of COVID, as Dr. Mkhize will tell us, is the attack on the human respiratory system, with problems that patients have with breathing that can cause loss of life. Medical ventilators are used to supply oxygen to the lungs of severely ill patients. Under normal circumstances, hospitals in South Africa have a basic and adequate supply of ventilators, ranging from the Ambubag resuscitators to nasal cannulas to CPAPs and finally to invasive ventilating machines. They typically buy these from suppliers elsewhere in the world based on normal need. But in March this year, participants, honorable colleagues, when the virus reached our shores, we had no local manufacturing capacity for ventilators, and yet the healthcare demand for ventilators surged. But today, as we speak, South African designed and manufactured ventilators are rolling off the production line. Over the next month, we expect many thousands of non-invasive ventilators to be delivered to hospitals and medical facilities across the country, brought together through South African ingenuity and by South African hands. I want to briefly tell the story of this innovation. In April this year, hospitals reported that they were unable to source ventilators on global markets. Minister Nzimande and I then decided to initiate the National Ventilator Project. We appointed one of our top agencies, the South African Radio Astronomy Organization, they are called SARAO, to serve as project managers given their world-class systems integration and systems engineering capabilities. These same scientists and engineers had delivered some of the technologies of the Square Kilometre Array project in the Northern Cape, the world's largest radio telescope project with the power to peer deep into the cosmos and to shed light on the mysteries of the universe. Based on the clinical experience in COVID-19 epicenters like China, Italy, the UK, and the US, senior critical care physicians advised us that we should focus on the production of non-invasive, continuous positive airway pressure devices, what are called CPAPs, because they had the greatest potential on saving lives. And so we put out a national call to our manufacturing sector, to research agencies, to universities and science councils, with the aim of rapidly facilitating the local development and manufacture of thousands of non-invasive ventilators. The response we received was phenomenal. Nearly 100 individual project proposals were received. These were thoroughly evaluated by the engineers and scientists at SARAO to ensure compliance with international standards for ventilators, but also usability in our hospitals and medical facilities, and to fully leverage South African manufacturing expertise. We needed a machine that can be used as easily in a private hospital in Sandton as in a field hospital in the Eastern Cape. Prototypes of the most promising proposals were then built. These were tested, first in the laboratory and then in one of our largest public hospitals. The designers took the machine through approval by the Medical Products Regulator. Funding was mobilized quickly from the Solidarity Fund, which was established early in the crisis by President Ramaphosa as a platform for South African citizens and businesses to donate towards addressing the challenges of the crisis. Ms. Gloria Serobi, chairperson of the Solidarity Fund, and her excellent team are present on this virtual call and this webinar today. Each machine consists of about 30 separately manufactured components. These have been produced in the past few weeks. Today, the first batch of completed ventilators are coming off the assembly line, part of an initial order of 10,000 units, which had been placed with the Council for Scientific and Industrial Research, our very own CSIR. A second manufacturer is also producing a further few thousand. 20,000 units in all will be produced. Final assembly of this device is taking place at the Acacia Medical Facility just outside of Cape Town, and from there it will be distributed to hospitals across the country. But this is just a final step. What happens in the Cape Town factory is just a final step in a supply chain that brings together components made by 8 different supplier companies across the country, from Centurion in Gauteng to the Dube Trade Port in KwaZulu-Natal and Buffalo City in Eastern Cape, to Central University of Technology in Mangaung in the Free State, and also the University of Cape Town. Incidentally, Dr. Nzimande, the Buffalo City component from Ikusasa Green, it's one factory, factory was initially incubated through the Competition Supplier Fund that was put up as a condition of the Walmart Massmart merger. And that company stepped up to produce a housing component for the CPAP. May I just take a moment or two to show a few photos of the device and how they will be used. And colleagues will see the first of these. This is a description, or rather to describe this is a medical technician holding the entire device, showing the blending unit and the patient mask. The device supplies a pressurized mixture of ambient air and industrial oxygen to the patient through a mask or hood. If we look at the second picture, this is a close-up of the blending device. The pressurized gas helps the patient by supplying a higher level of oxygen and by keeping the airway and lung pressure elevated above the surrounding air pressure through the breathing cycle. And this ensures that the patient's lung is operating effectively. If we look at the third picture, this is the medical operator who adjusts the inspired oxygen proportion of the gas that's supplied to the patient, and she can adjust the elevated pressure to the required level. The fourth picture, which is now on, no, just the one before that. The achieved pressure that you can see in that one, there we are, thank you, just there we are. The achieved pressure can be monitored by the medical operator. Infection control, of course, is critical to prevent the spread of the virus in the healthcare facility itself. For this reason, how we manage the exhaled air and the proper sealing of the mask and the hood is important. The final picture, there we are, is the assembly and packaging of the CSIR device that's taking place in the Acacia medical production outside of Cape Town. Colleague, I want to conclude with the observation that the shortage of testing kits and ventilators and medical grade masks and other PPEs have underlined the importance of Africa developing a strong innovation and manufacturing capability of building more resilient economies. The ventilator project shows what is possible. Disease and poverty are the challenge. Science and solidarity are the weapons to fight this. Within the space of 4 months, our country has gone from having no capacity to produce CPAP ventilators to now having the first units coming off the production line. As we build our production capacity, we will also support our neighbors across the African continent with these ventilators. South African manufacturers have produced sanitizers, masks, and other critical medical goods that have gone to neighboring countries. The National Ventilator Project is one example of solidarity and science of what we can achieve when we work together towards common objectives. Other strong initiatives has been the production of millions of liters of locally made hand sanitizer and surface disinfectants every month, and the doubling of local production of medical grade masks from 6 million a month to 13 million a month. And now we need to bring that same spirit to the wider task of economic reconstruction and use our technologies, our know-how, our expertise, and our social solidarity to rebuild our economy and strengthen the African continent. May I conclude with the appreciation, colleague Dr. Nzimande, for this very timely webinar, bringing together an exceptionally strong team of scientists and and other specialists. Thank you all, and Eid Mubarak to the Muslim brothers and sisters. I thank you.
Thank you very much, Minister Patel, for this wonderful work that's been done. I am now going to humbly request Excellency, the African Union Commissioner for Human Resources, Science and Technology, Honorable Professor Sarah Anyang Agbo, to give her comments. Over to you, Excellency.
Thank you very much, my brother, Dr. Phil Mtwara. Thank you very much. It's been a pleasure listening to everybody who has spoken. I want to recognize His Excellency, the President of South Africa and Chair of the African Union Commission, His Excellency, President Cyril Ramaphosa. I want to recognize the presence of His Excellency, Dr. Blade Nzimande, and Dr. Zweli Mckinsey, and Dr. Patel. I want to Mr. Ibrahim Patel. I want to recognize the presence of our big brother, Dr. Tidris, and my sister, Dr. Shamila, and all excellencies, honorable ministers, deputy ministers, ambassadors, and distinguished researchers and scientists, and esteemed participants who are participating in this timely webinar. I want to thank you for extending invitation to the African Union Commission. This shows your commitment in our efforts to run along with the vision for the Africa we want by 2063. I therefore bring you greetings from the chairperson of the African Union Commission, His Excellency Dr. Musa Faki Mahamat. He extends fraternal greetings of love, peace, and hope. Speaking on behalf of the African Union Commission, this conference, the theme of the conference is very timely. And that theme is, the theme of the conference is very timely. And that theme is harnessing science, technology, and innovation in response to COVID-19, a national and international effort. The coronavirus outbreak crisis in the whole world has not spared African countries. And it strongly reminds us again and again that our continent is already overburdened with infectious and chronic diseases, of which the vast majority could be tackled and prevented if Africa builds a strong and functional integrated research and innovation ecosystem that is capable to unlock potential solutions to the challenges the continent faces. African scientific and research community should be truly empowered to lead efforts to set locally relevant scientific agendas that offer greatest opportunity for our socio-economic development. And all the previous speakers have underscored the importance of us giving African solutions to African challenges. I sincerely was very humbled by the commitment of South Africa and the various interventions you've taken within your national fair to provide answers and solutions to the COVID pandemic. I want to say that this webinar today, bringing together political leadership, health practitioners, researchers, academia, business, civil society, and the African and international communities to deliberate and recommend ways for harnessing science, technology, and innovation in response to COVID-19 and future pandemics is commendable. I would therefore like to thank His Excellency President Cyril Ramaphosa of the Republic of South Africa and the Chairman of the African Union, and His Excellency Dr. Nzimande, Minister of Higher Education, Science and Technology, and his team for their unwavering commitment to the development of science, technology, and innovation in the continent, and that we provide appropriate response to COVID-19 and future pandemics through research and innovation. Siyabonga. While African countries have relatively experienced lower numbers of confirmed cases, there is a serious threat that the continuously rising cases and fatality in the continent will have serious social and economic repercussions due to our level of preparedness, available response, capacity, and the state of our health systems. Thanks to the African CDC, in collaboration with regional and national CDCs, that has mobilized a formidable support domestically and internationally to enable member states to deal with this global pandemic in addition to the local efforts. However, we are aware that science, technology, and innovation are at the center of this outbreak to provide appropriate solutions for 1, diagnosis, 2, therapeutic, 3, vaccines, and 4, the production of personal protective equipment and medical supplies. This requires a functional system of science, technology, and innovation that is built on strong transnational collaborative approaches that utilize our diversity, range of existing capacities, and expertise while leveraging international partnership. Intra-African collaboration is key. Inter-African collaboration is key if we are to win this race. Currently, a lot of work is going on continent-wide, but with minimal collaboration among our countries or researchers and among our regional economic communities. As you said, Honorable Dr. Blade Nzimande, whatever experiences we have been able to do so far should be able to be shared amongst ourselves. The strides you have taken at South Africa are best practices that could be shared within the region and across the continent. And I believe this conference opens up for other countries to emulate your example. For us to successfully harness science, technology, and innovation in response to COVID-19, I would like to recommend the following. 1, establishment of a Continental Public Health Research Alliance that brings continental public and private stakeholders and global partners to support and fund coordinated continental public health research in the short term, focusing on development of vaccines against COVID-19, diagnosis, and therapies. Yesterday, we had a conversation saying that we need to start work on a regional level, bringing member states on regional level to have a coordination of a kind like a center of excellence for innovation, maybe for vaccine production, maybe for traditional medicine translation into modern medicine in solving the problems of COVID. 2, foster through our national, regional, and continental educational and training strategies the development of critical human capital needed in the health and other technical sectors through boosting STEM education and paying special attention to youth and women. 3, vigorously pursue the development and use of Africa's rich traditional medicines and indigenous knowledge as crucial healthcare options through appropriate, comprehensive policy frameworks and guidelines at the national, regional, and continental levels. 4, improving scientific capacity, infrastructure, and preparedness for pandemics by strengthening and building the required biosafety level laboratories, in particular, strengthening the few P3 and P4 laboratories in the continent. 5, support and fund the African Scientific Research and Innovation Council, ASRIC, work that is focusing on mobilizing the scientific community to carry out studies on impact of COVID-19 on Africa's food and nutritional security, socioeconomic impact, and on Africa's indigenous knowledge to preventing and controlling emerging infectious diseases on the continent like COVID-19, utilizing an Afrocentric response. Strengthening its advisory committee of COVID-19 to support policy and decision making. And 6, Africa should develop capacity in science, technology and innovation, intelligence, forecasting, and science advice to respond, mitigate, and prepare future pandemics. And 7, we call upon member states to embrace our collective heads of states and government decision on 1% GDP allocation to research and development and how to increase the funding for science, technology, and innovation at the national and regional levels. and aid to promote intra-Africa and international cooperation in science, technology, and innovation. We need to embrace science diplomacy and open science, as the previous speakers have said, and we can improve lives and have common solutions if we do so. The Continental Science Technology Innovation Strategy for Africa 2024 is pivotal in the implementation of Africa's science agenda. In the face of the current COVID-19 pandemic, the scientific community and policymakers must vigorously join the entire world in drafting rapid research and innovation response policies and implementing Afrocentric programs for the co-creation of knowledge and development of vaccines, new treatments, diagnostic tests, and medical preventive systems to COVID-19. This will, in the long run, ensure social stability, resilience, and security for the African people. Indeed, Your Excellency, Dr. Blade Nzimande and Dr. Zweli Mkhize, a multidisciplinary approach is needed to look at solutions to the pandemics. In our effort at the Commission, we ensure that Agenda 2063 is underpinned by education, science, and technology. At the continental level, we have created a specialized technical committee on education, science, and technology to periodically engage with ministers in charge of these sectors to take collective decisions. We have also established a committee of 10 heads of state and government as champions of education, science, and technology in the continent. The Commission elaborated 3 distinct strategies for education. One is the Continental Education Strategy for Africa 2016-2025, the Science, Technology, Innovation Strategy for Africa 2024 to drive human capital and development, and the Technical and Vocational Education and Training Strategy for Africa. These strategies enable us to break down barriers that create a fragmented systems on the continent through strengthening coordination and addressing weak levels of investment in both education and research and innovation. April 30th, we had an extraordinary ministerial virtual meeting of the STC-EST to look at responses in mitigating COVID-19. The Science, Technology, Innovation Strategy for Africa, STIZA 2024, in particular, fosters social transformation and economic competitiveness through responding to the demand for science, technology, and innovation across various socio-economic sectors, of which health is one. It furthermore promotes building and upgrading research infrastructures, enhancing professional and technical competencies, innovation and entrepreneurship, and creation of an enabling environment for STI. Listening to you, Dr. Blade Nzimande, your insights through your presentation shows the importance of consolidating STI in mitigating COVID-19 through strong partnership with relevant stakeholders. And in the speech of His Excellency President Ramaphosa, it is stated there that STI is the only way to leverage the effects of COVID-19. We need each other. And this conference reaffirms that we must continue to work tirelessly to create solutions for the challenges of COVID-19. There is need for us to utilize the brightest minds and brains of the continent within and in the diaspora. Yes, we must invest in a vibrant Pan-African science response. So lasting gratitude to Your Excellency President Cyril Ramaphosa. Thank you for leading heads of states to consolidate STI and concretely implement steps to mitigate COVID by harnessing the potentials of STI and strategic partnerships for post-COVID recovery. We need to have solidarity in the lines of subsidiarity and complementarity. And I agree, sir, STI is the key milestone for us to move towards this vision. Excellencies, as our forefathers taught us, a tree does not make a forest, and one hand cannot tie a bundle. Together, we forge strong partnerships driven by our shared values and policy objectives. Our coming together like this is a beginning to change the narrative, and keeping together will make us to have progress. While working together, we can achieve success so that our Africa will arise out of Africa will arise world champions setting the pace. Excellencies, distinguished researchers, the organizers of this particular conference, I want to say thank you very, very much for organizing this conference. And I know that at the end of the day, we are going to have solutions that together, nationally, regionally, and continentally, we can move together and make sure that we are able to mitigate the problems of COVID-19 in our world. Thank you very much, Dr. Phil Njera. I appreciate these efforts.
Thank you very much, Professor Anyang Agbo. It is now my pleasure to request Dr. Tedros Ghebreyesus, who is the World Health Organization Director General, to give his address.
Had been better if we cut it a bit. Okay. Thank you very much, Director General. Your Excellency, President Cyril Ramaphosa, through his representative, Your Excellency, my brother, Dr. Zweli Mkhize, Minister of Health, Your Excellency, Dr. Blade Nzimande, Minister of Higher Education, Your Excellency, Dr. Ibrahim Patel, Minister of Economic Development, Your Excellency, Professor Sarah Anyang Agbo, African Union Commissioner for Human Resources, Science and Technology, Excellencies, dear colleagues and friends. First of all, I would like to express my gratitude to Your Excellency, President Ramaphosa, for convening this very important event, but also for your leadership as Chair of the African Union during this unprecedented crisis. Regional solidarity is critical, and your efforts in developing the continental strategy and the coalition of business and political leaders have been very important. We know South Africa is now facing a serious challenge with community transmission and increasing numbers of deaths. I send my deep condolences over those you have lost. I send my admiration for your health workers who are working tirelessly to save lives. And I offer WHO's steadfast commitment to work with you to defeat the outbreak. It's important to remember that no matter the situation, it can be turned around. It's never too late. Many countries have demonstrated with determination and the right actions, transmission can be interrupted, lives can be saved. Since the beginning of the pandemic, science and innovation have been at the forefront of the response. At the beginning, we knew very little about the virus that caused COVID-19. We needed serious, accelerated science, and we needed it fast. The only way to do that was by working together. In its role as a global health convener and coordinator, WHO has worked with partners around the world to accelerate this critical research and innovations with unprecedented speed. Within days of learning of the first cases in China, we published extensive guidance on how to find, test, and treat cases and protect health workers. We also published the first protocol for testing for the virus and immediately started working with a manufacturer in Germany to produce tests and ship them to countries most in need. We convened hundreds of scientists to develop a roadmap for research in early February. We have brought together thousands of experts from all over the world in many disciplines to analyze the evolving evidence and distill it into guidance. Never before has WHO produced such a large volume of technical advice in such a short period. More than 4 million people have been enrolled in our training courses through the openwho.org online learning platform. It was clear that the only way we could take on this unprecedented global challenge was with unprecedented response, working together across institutions and borders for our collective future. That's why we have launched a series of innovative scientific and logistical collaborations under the theme of solidarity. Solidarity is our only way forward. In March, we launched the Solidarity Trial to quickly generate the robust data we need to know which therapeutics are the most effective. By enrolling patients in multiple countries, the Solidarity Trial aims to rapidly discover whether any of the drugs slow disease progression or improve survival. So far, more than 5,500 patients in more than 20 countries have joined the trial. WHO has also established Solidarity 2, a global collaboration for serological surveys of the virus that causes COVID-19. A complete understanding of the epidemiology and global risk posed by this novel virus requires systematic serologic testing. Serologic testing detects antibodies in the blood that indicate if a person has already been infected. This information is critical. It tells us how frequently infection occurs among different populations, how many people have had mild or asymptomatic infection, and how many people have been infected but may not have been identified by routine disease surveillance. It also may tell us what proportion of the population could be immune in the future. This will allow local, national, and international decision makers to respond collectively and more effectively to the pandemic. Solidarity 2 is unique in several interconnected ways. It provides a global platform for government and academic collaborators to share cutting-edge scientific advances. It accelerates global progress towards understanding the COVID-19 pandemic. It provides every country access to the tools and procedures needed to conduct their own serologic surveys, and it promotes access to scientific discovery for all populations globally. Of course, one of the most active areas of innovation is vaccines. Less than 8 months into the pandemic, more than 200 vaccine candidates are in development, and more than 20 have started human trials. We commend South Africa for participating in one of those trials in collaboration with the University of Oxford. Our vaccine work includes 4 critical elements. First, harnessing a broad global coalition to develop and evaluate candidate vaccine as quickly and safely as possible. Second, mapping candidate vaccines and their progress across the world. Third, defining the desired characteristics of safe and effective vaccines. And fourth, coordinating clinical trials across the world. But innovation is only part of the answer to this pandemic. Together, we must all ensure that all people have access to the fruits of innovation. We must make sure that vaccines, diagnostics, and therapeutics for COVID-19 are global public goods, not another reason that more people are left behind. That's why WHO worked with the European Commission and other partners to form the Access to COVID-19 Tools Accelerator to speed up the development, production, and equitable distribution of vaccines, diagnostics, and therapeutics. To complement the ACT Accelerator, WHO also worked with the government of Costa Rica to launch the COVID-19 Technology Access Pool, or CTAP, which compiles COVID-19 health technology-related knowledge, intellectual property, and data. Local production is also key to ensuring access, especially in our continent, Africa. I encourage you to invest now in building capacity for local production so that when vaccines and therapeutics are available, you will be able to rapidly scale up access, not only for South Africa, but for the continent. In addition to our work on vaccines, diagnostics, and therapeutics and serology studies, WHO is also working to harness the power of digital technology against COVID-19. Our new Digital Health and Innovation Department has developed 2 key mobile products aimed at supporting health workers and informing the public. First, the WHO Academy app provides health workers with mobile access to a wealth of COVID-19 knowledge resources developed by WHO that include up-to-the-minute guidance, tools, training, and virtual workshop that will help them care for COVID-19 patients and protect themselves. Second, the WHO Info application is aimed at the general public and gives millions of people real-time mobile access to the latest WHO initiatives, partnerships, and up-to-date information on the race to find medicines and vaccines for fighting the disease. The number of COVID-19 cases organized by country and by timelines is continually updated in the app from the official WHO COVID-19 data streams. Social science is critical too. This pandemic has upended daily life, travel and transportation, education, jobs, societies, and economies. We must mobilize insights into human behavior and societies to rebuild communities, countries, and a better world. Excellencies, dear colleagues and friends, to defeat this pandemic, science, technology, and innovation must all play a crucial role. The very fact that you're holding this event shows that you know this already, but there is one ingredient that's even more important than science, which is solidarity. Science, technology, and innovation are tools that can be used either to widen inequalities or to narrow them. WHO's commitment is to bring scientists, researchers, innovators, and nations together in a spirit of solidarity to ensure shared solutions to this shared challenge. Science is the most powerful when it benefits everyone. After all, we're one humanity. We share the same DNA, same planet, and the same hopes and dreams. We're all in this together, and we can only prevail together. I thank you.
Thank you very much, Dr. Tedros. Minister, I'm not so sure because we are running late. Shamila is looking at me badly. She says I will never be allowed at UNESCO anymore if we drag this beyond the 10:15 slot. But I'm sure you probably have 1, 2, or 3 reactions to some of the offers that have been made and some of the inputs that have been made, especially with Professor Sarah as well as Dr. Tedros in terms of the partnerships that we have to keep going beyond just today.
Thank you very much, DG. I won't be long. I'll be very, very brief. I'm aware of our time pressures now. And also, I don't want to be in Shamila's wrong books. I want to just say that thank you very much. I think we have set the bar quite high with these initial inputs in this particular session, with emphasis on solidarity, the absolute importance of collaboration. I would also just like to strongly agree with Professor Agbo on the need for common continental research platforms like she was arguing. It's something she argued for, a very specific one, which I think it's something that is very important. I also just want to say quickly that at the initiative of our president, we'll be starting a feasibility study towards establishing a dedicated University of Science and Innovation in South Africa. And clearly, this could be an important resource, not just for South Africa, but for the continent as a whole, in which we can be able to place some crucial programs. Also, I want to say thank you very much to Dr. Ghebreyesus for your continued commitment to the African continent, whilst, of course, working with the rest of the world. The partnership, and for us as South Africa, we've benefited a lot from your openness, of WHO expertise, platforms, and so on, to be able to do work in this. We really appreciate that. But I would like to thank everyone who participated, including my colleague, Minister Mkhize, that we are working together on many of these things I also thank my other colleagues who are here that we are working on various platforms. I am looking forward to the rest of the panels. Thank you very much, and also thanks to you, DG, for chairing this opening session so well. Thank you very much.
Thanks very much, Minister, and we apologize for running about 15 minutes late, but I'm sure you'll agree with me, over 400 participants who are listening to this discussion, that it was a worthwhile set of inputs from our leaders. So Shamila, as I say, I apologize. You have a 15-minute deficit, but I'm almost certain that you'll be able to make it up. Over to you, and thanks again for agreeing to moderate the second session.
Hello, can you hear me? Hello? Good up.
Over to you, Shamila, we can hear you. Thanks.
Thank you. Thank you very much, DG. And thank you for inviting UNESCO to be part of this very innovative webinar. Our sincere thank you, and I bring you greetings from the Director General, Madam Audrey Azoulay from UNESCO here in Paris. It's certainly a privilege for me, honorable ministers, excellencies, ladies and gentlemen, to chair and to moderate this first panel on health research. I would like to personally thank all the ministers, my sister dear Sarah, with whom we work very closely, putting back science to the African continent, and especially Honorable Minister Blade Nzimande for all his support to UNESCO, bringing back science to the African continent, so that, as the Madiba always said, let's put a face to science. UNESCO congratulates the South African government and His Excellency President Ramaphosa for convening this timely webinar, and me as a fellow South African, I'm deeply honored to moderate this session. Before we start with the panelists, I would like to probably share 2 points with all of you, that the focus really is on identifying boundaries and tipping points that could have far-reaching consequences for our planet's equilibrium and thus for ourselves. So this international scientific cooperation is arguably more imperative than ever before, as has been highlighted by our dear colleague, Dr. Tedros as well, and the previous speakers before me. We really need scientific cooperation, international scientific collaboration and solidarity, if we are to reverse the knowledge gap and therefore ensure that development is inclusive and sustainable.
Very important conversation, but we're coming out of that science and innovation briefing because we're following more than one story this morning. Let's go live now